Okay, so let's get started today. Really warm welcome to those of you that are joining as new members of the Nursing Now Challenge community, either as individuals or organisations. Those that you are just interested in learning more about Nursing Now Challenge, so our curious attendees, and also those of you that are established members of our community here to support and contribute to sharing in more information about what we're here to do and how we go about doing it. So really warm welcome to you all. I'm just going to ask Hannah to share some slides with you, and we'll take you through a bit of information around Nursing Now Challenge, including its kind of underpinnings, its grounding, and where we're going to in the future. Okay, so if we flip onto the first slide, thank you. So Nursing Now Challenge is very much grounded in global nursing and midwifery policy priorities. We are underpinned by the State of the World's Nursing Report, the Global Strategic Directions for Nursing and Midwifery, which both identify nursing and midwifery as absolutely core to achieving the Sustainable Development Goals. Now, for those of you that aren't familiar with this policy landscape, we'll just briefly outline a little bit more information. So on the next slide, an outline there of the Sustainable Development Goals. And obviously, very relevant to us is number 3, good health and well-being. But when you look at many of the other Sustainable Development Goals, you can see that nursing and midwifery are either very much impacted by these goals or have opportunity to influence the achievement of them. So, for example, number 5, gender equality. As a large workforce within a global community that's primarily a female-dominated workforce, the working conditions, opportunities for nurses and midwives have a real big impact on gender equality. Similarly, if we think about climate action, nurses and midwives and the health service as a system makes huge contribution to climate issues and has real potential to change the ways that we work in order to reduce our implications, but then also to think about how we adapt as communities and mitigate for the impacts of climate change as well. The list could go on, but there's many areas that nursing and midwifery impact or are impacted by across these Sustainable Development Goals. This is picked up, if we move on to the next slide, in our strategic directives for nursing and midwifery, which were published by the World Health Organization back in 2021 and extended to 2029, which is very much focused on around education and seeing nurses and midwives as the real power and workforce that will actually achieve population health needs. To think about how that translates into meaningful and well supported roles, how that impacts on our retention, our recruitment into the profession, to make sure that we have the workforce with the right skills and competence in the right places at the right volume. There's also this really key area around leadership, and what we mean by this in relation to this particular policy directive is that nursing and midwifery has the rightful place around the global table to influence the direction and the way in which health and care systems are operationalised in country. And unfortunately, for too long, the clinical voice has been very much dominated by medicine. But what the strategic directives for nursing and midwifery are wanting to achieve is a much more visible and vocal position for nurses and midwives in that leadership space. And then finally, this is around the respect and the right kind of social positioning of nurses and midwives, so that we are protected as a profession, that we are motivated to do our best for our communities, patients, and equipped with all of the right kinds of tools, skills, and confidence to do that. I'm not sure if Hannah's aware, but there's a message box popped up asking if we wanted to add translation. So I'll just let Hannah know that that's there and popped up on the screen. Now, lastly, if we think about the State of the World's Nursing report, which was published at International Nurses Day, so nearly a year ago now in 2025. And Nursing Now Challenge had a really significant role within the State of the World's Nursing report in the recognition that this is absolutely key to including the student and early career voice within the future of the world's nursing workforce. And this is really key because that's never really been achieved in this way before. So when we think about the future, we think about the voices of students and early career nurses within shaping that future. And we won't achieve the recommendations of this report unless that voice and that influence is really central to that. So just really briefly, I'll run through the recommendations and the ones particularly relevant to us. So next slide. We can still see that message box as well, Hannah. I'm not sure if, unless I can get rid of it. Oh, it looks like I can get rid of it.
I can't see it, sorry.
I've got it. Okay, so in terms of the State of the World's Nursing report, there are some key recommendations that have been informed by a huge data gathering exercise across the world to really give us our first and best quality insight really into where our nursing workforce is in terms of numbers, in terms of the educational preparation that they have, the leadership available to them, the status and the pay and working conditions. So it's really a great insight and data-driven opportunity to influence policy. And some recommendations came from that data set, really about thinking about roles, nursing jobs, and thinking where we do have gaps across the world and where the greatest need is. Thinking about how we strengthen what we call our domestic education systems. So countries being able to develop a workforce themselves to service the health needs of their own countries. What's needed in order to attract nurses, students into nursing, and retain them, so their working conditions, the pay equity, and ensuring that they have the right wellbeing and mental health support to do the jobs well. Also to think about our regulation, and particularly around advanced practice nursing roles. So how can we enable nurses to be working at the full scope of their practice, and how advanced practice is enabling nurses to step into spaces through the right kind of education and competence that's really meeting the needs of their community through advanced practice. Our next recommendations are around our digital technologies. So how can we really harness and take advantage of digital technologies to enable nurses to be able to provide the care that they need to in the most efficient and productive way. So really giving them the tools to utilise, to have the information, to be able to inform their decision making, and really enable them to focus on the person-centeredness of the care. And then also thinking about climate as well. So as I said before, how can we be part of the solution? So how can we be thinking about how we reduce the carbon emissions associated with the way that we deliver care, but also how can we prepare communities to respond to the impacts of climate and make those adaptations and mitigations to respond to that. We talked already about gender equity and really thinking about how we do offer that protection to nurses, particularly those working in settings affected by conflict. And finally, and really importantly to us as Nursing Now Challenge, thinking about that nursing leadership and really making sure that leadership development opportunities are available to all across the world. And that really is where Nursing Now Challenge comes in. And when we think about nursing leadership, what we're really perpetuating a message that leadership isn't about formal authority. It's not about a title that you might hold in your clinical setting. It's really about how we influence and how we make change happen for the benefit of our communities, the people that we're supporting, our patients. So I'm just going to pause now and share with you a little video on Nursing Now Challenge, which really brings to life how we work and what we do.
The Nursing Now Challenge is a global community of early career nurses and midwives like myself.
It is this vast, boundless global network that is huge. It's immense, spreading from the Americas to Africa to the Western Pacific and beyond.
At its core, it aims to empower young nurses and midwives like myself to be leaders and drivers of change in our communities and in every level of healthcare that we occupy.
I cannot even put words to describe how powerful and how pivotal and influential this opportunity has been for me in my nursing career.
Joining the Nursing Now Challenge was a leap of faith, and it turned out to be one of the best decisions I have made.
This experience has enabled me to network with other young nurses in healthcare to bring up innovative ideas.
This community of Nursing Now Challenge gives us a voice.
I've joined global discussions, moderated my own webinar series, connected with inspiring academics worldwide.
My colleagues like Sana, who shook the worlds of lawmakers at the World Health Assembly, and nurses like Lincoln, who are paving the future of our profession through AI technology.
The most important one for me as well is leveraging innovation to address those healthcare challenges.
Through the Nursing Now Challenge Global Solutions initiatives, courses like the Health Action Training and other webinars and workshops on global health issues, you get an opportunity to interact with global health leaders in different spaces.
Being part of the Nursing Now Challenge is really transformative.
It's transformative.
Transformational, profound, and innovative.
Nursing Now Challenge is much more than just an international collaboration network.
It's a movement that amplifies the voices of nurses and midwives.
One of the greatest benefits of the Nursing Now Challenge is the power of connection.
It is very special and it is very empowering.
It has been the best thing I've ever done.
Achieving universal health coverage and healthcare for all is actually possible, and we are making it happen.
The statistics are powerful, but the impact of the Nursing Now Challenge remains immeasurable.
So join us today.
I can't help but be inspired by that film every time I hear it, and I could only reiterate the messages that are portrayed so brilliantly from members of the Nursing Now Challenge community globally. Just to reiterate some of those key messages, that we are a global community. At the moment, we are reaching around 250,000 student and early career nurses throughout the world. There are 1,275 organisations across 156 countries that are engaged in this community. And we really hold a strong vision that our role is to support this community of students and early career nurses and midwives to feel equipped so that they can lead transformational change and advance health equity to strengthen their systems worldwide. Now, we know we can't do this in isolation. We have to be a community, we have to be networked, and we need to provide the right kind of education and support and opportunity in order to be able to achieve those things. So that's our mission as a programme, really to develop the members' leadership and advocacy capabilities, but also to enable them to have opportunity to influence. And that's about being able to speak to decision makers. It's about understanding how to use the evidence base to support their position and their opinions, but also to think about how they can work collectively as a global community and then individually as countries to really make a difference. And we do this really through our educational offers, but also through the stakeholders that we work closely with, who enable us to create those opportunities for our community to have a voice and to bring that student and early career perspective to decision makers' awareness. we're very much a values-driven community. So we very much believe in the potential of every single student and early career nurse and midwife ability to lead. And by that we mean influence, change within their communities. We think about the power of community as our main vehicle really for making a difference. So as individuals, we often can see where the challenges are and we have ideas around what those solutions might be, but we can feel quite isolated as individuals who have these insights and have that motivation and passion to want things to be different. So we bring people together that are like-minded, that share those passions and those commitments. And through that networking and through that community, we really start to see change happening. We try and think globally, but also apply our learning contextually. So everything we think about as a community, we consider from the various different perspectives of people that join each of our individual interactions. So we're very conscious of really saying, understanding and learning from our community. What does this particular issue mean for you in your context? When we talk about terms like resilience, for example, or influence, these kind of language that I've used throughout today's presentation, what does that mean to you in your context? And we're constantly learning and understanding from our intercultural community. As I mentioned before, we're very much evidence informed, so we work really closely with the World Health Organization to make sure that we are very much aligned with the strategic directives and the State of the World's Nursing Report recommendations, but also we're very much aware of the new evidence base, the new research that's coming throughout the world that's informing our practice, that's informing the way that we go about influencing change, and we share that amongst our community, as well as contributing to that evidence base as well. So members of our community are often parts of invited to comment on particular issues. They have been participants in research, which is then being used by the World Health Organization to inform their strategic thinking. So there's lots of opportunity to both use the research to empower you, but also to contribute to that research as well. Inclusivity is really at the heart of everything we do. So we are all about diversity. Every single conversation that we have represents huge diversity of experience, of culture, of religion, of understanding of how the health and support and care system works within that context, and also how nursing's role can really make a difference in that context, depending on the different levels of hierarchy within that particular area, the politics that are most influential in that space. So we're constantly considering what makes our community diverse, rich, and insightful. And that means that we're always learning. We never stop learning. And sometimes we might get things wrong, and we are part of a community that has worked hard to think about how we can safely challenge each other, question some of the assumptions that we hold, and encourage each other to learn from our experiences. So our next slide now enables me to introduce the broad range of our membership. So this visual, I think, really brings to life the breadth of that representation. So we're, as I said before, reaching 250,000 of nurses and midwives across the world. It's really diverse in terms of where people are coming from. You can see just even on today's call, we're representing each of those different WHO regions, which is just wonderful to see. And you can join as an organisation and make this available to all of the nurses, early career nurses and students in your organisation, or you can join as an individual. So both types of membership are very much welcomed. And really importantly, it's completely free. So no cost at all to you as an organisation, as an individual to join, and you will get the benefit of all of those resources and opportunities, and we'll tell you a little bit more about those in just a moment. So if you do choose to join, or if you have chosen to join, you will receive from the team here at Nursing Now Challenge a welcome pack, which has really every bit of information that you need to know about Nursing Now Challenge. Straight away, we'll add you to our mailing list, so you receive the newsletters, updates about all of the opportunities that we're offering. And we'll also recognise your organisation within our website as part of our global network. As individuals, you will have the opportunity to join our Challenges Committee, and this is where you can take a real leadership role in shaping the direction of the Nursing Now Challenge programme. But we also ask you, when you become part of the community, if you're an organisation, to think really carefully about how will you make sure that all of your students and early career nurses know about this opportunity. If you're an individual, how will you tell your peers, your friends, others, and encourage them to get involved? As soon as you become a member of the community, we sort of take a responsibility to be an advocate and a champion for Nursing Now Challenge. We're constantly communicating with everyone through our various social media platforms. So we'd really encourage you to follow us across various different social media. And again, we'll give you some more details on that, because opportunities to engage are continuous and always really, really exciting. We also have several different initiatives, and this is really where we create opportunities to learn as a community, but then also opportunities to influence. So at the moment, we're running what we're calling our Leadership Insights programme, and that is a series of webinars that are on topics which will enable you to think about how you lead from the position that you're in now. So how do you understand how to influence change? How do you create credibility in the way that you communicate? How do you think about the potential levers that you have and the networks that you can become part of, so that you can really take forward the ideas and the experiences that you have to improve the systems that you're working within? And that can be locally, nationally, regionally, and even globally. We also have what we call our Global Solutions Initiative. And this is where we put out a challenge to our community around a particular topic area, or something that is something that our community have told us they're interested in learning more about. And our Global Solutions Initiative, again, is partly about education. So we share with you information resources through webinars with really interesting speakers. But it's also about our community coming back to us with what they think is the potential solution to that particular challenge. So, for example, we've just completed a Global Solutions Initiative around antimicrobial resistance. And our challengers had the opportunity to suggest ways that practice could be changed in their local context. They submitted their ideas, and a number were selected as winners of that Global Solution Initiative, and will be provided ongoing support and mentorship to take those ideas forward. At the moment, we're running a Global Solutions Initiative around research, competence and capability, and our winners of that Global Solutions Initiative will have opportunity to present at the Royal College of Nursing Research Conference. So a great area to get involved in. We also have our Global Book Club, and a couple of times a year we select books that are really relevant to our community, and members of our Challenges Committee have the opportunity to interview the authors of those books, and we can put questions to them from our community to understand more about and bring to life those books. We have one coming up in June around flourishing in nursing, so I'm really looking forward to that one. Our Challenges Committee is really the focus of where the work happens. So for those of you that want to engage in Nursing Now Challenge and take advantage of all of the resources we put out there, that's absolutely fine. But those of you that really want to be part of shaping the direction of the Nursing Now Challenge and really get involved in what happens globally and in your country, we'd really encourage you to join our Challenges Committee. And again, I'll tell you a little bit more about that. We have a partnership with the Nursing Times, where our members of our community are invited to submit opinion pieces which are published within the Nursing Times. And we also provide education more focused around leadership through a programme called Health Action Training. And this is something that's exclusively available to our Nursing Now Challenge community and helps them to think about how they develop their leadership, confidence and capability in the position that they're in. We have a great new initiative that's launching in the summer in partnership with the Centre for Sustainable Healthcare to think about planetary health. So what role can nurses and midwives play within the sustainability agenda? And then finally, our grassroots podcast. So members of our community have created a podcast where they are either interviewing or being interviewed by other members of the community to share insights into their experiences on some really topical issues. One of the recent ones focused around nursing within a conflict situation and the impact and the lived experience of some of our members of our community of that, focused on Ukraine. We also have members of our community that have been really highly engaged with us right from the outset, and they're now reaching a stage where they're not newly registered anymore. They're actually very experienced and over 5 years post-registration, and they still have a huge amount to offer to our community. So a pathway has been developed for our alumni, which will enable them to continue their leadership and contribution to this community through mentorship, through being trained as clinical supervisors, and also leading various different communities of practice. So people that join our community have a long involvement with us into their careers. As I mentioned before, the Challenges Committee is really for those of you that are really looking to be engaged at a higher level with the programme and take a leadership role within that. And we also we arrange our Challenges Committee around the WHO regions, and we have representation within those regions of leaders who are taking forward the specific agenda of that particular context. So entirely up to them how they want to go about doing this and developing this, but many of them put on context relevant webinar series or initiate dialogues that enable the learning of Nursing Now Challenge to translate into that particular region. You'll see that there's openings across our regional hub leads. So again, if you want to have that more significant leadership role on the challenge, we'd really, really welcome your expression of interest. Now, I've hopefully described to you a bit about what Nursing Now Challenge is, but I definitely can't describe to you how it feels to be part of this community as a student and early career nurse. So I'm really pleased to introduce you to Shazia from Pakistan, who's going to share with you a bit about her experience of her journey through Nursing Now Challenge.
Thank you so much, Gemma. Hello everyone, my name is Shazia. I'm from Pakistan, working as a registered nurse in Kuwait. I'm so obliged for the Nursing Now Challenge for giving me this golden opportunity to share my experience today. And I'm a huge supporter of these welcome and orientation webinars. I think it's an initial step to the ladder of exponential growth and learning prospects. So back in 2024, I gained insight about this organization in a similar encounter and registered myself as a member. Since then, Nursing Now Challenge has been a game changer for me, a potential source of daily inspiration and endless opportunities. My journey from joining this organization as a member and stepping up to a leadership role has been a huge milestone in my educational and professional career. When I graduated from my nursing school and started working as a nurse, I was looking for opportunities beyond the hospital walls that would connect me to a global nursing community and become a voice for change. And then I came across Nursing Now Challenge. That connected me to a global village of nurses making impact beyond measures, be it education, nursing research, policy, advocacy, advanced nursing practice, leadership, and much more. My active engagement gave me the confidence to keep the learning process going, and it's all due to the Nursing Now Challenge. And it would be unfair to not mention the engagement of the Nursing Now Challenge during the launch of the World State Nursing Report 2025, which has been a transformative venture for me. The role of this organization in the dissemination of the report information in all the WHO regions while engaging passionate students and early career nurses was truly remarkable. As a lead, I got the chance to ensure regional engagement, represent Nursing Now Challenge in Kuwait, and be part of the global nursing movement. The report provided up-to-date and comprehensive data analysis featuring critical areas of the improvement, provides a strong base for the future of nursing, and influencing its utilization would be at the heart of Nursing Now Challenge and leaders like me. To put it concisely, this platform has provided me a robust base for ongoing growth and career advancement. Well, sometimes this influential course of engagement makes me question why I did not join as a student, but I joined as an early career nurse at least, and that was the best decision I ever made. So if you are a student, an early career nurse, midwife, the chance is yours. If not today, then never. So don't miss this golden opportunity and be part of it. Thank you so much.
Oh, amazing. Thank you so much, Shazia. That's really wonderful to hear. And I think we can be confident that there are many others that would speak to those benefits of the Nursing Now Challenge. And when I listen to Shazia and other members of the community, what I get a sense of is that real ability to look up and out, and that opportunity to understand what their experience on a day-to-day basis in their clinical practice, how that is situated and impacted by other things that are happening across the world, and how they might be able to be part of a conversation that influences that bigger picture around the profession. And that feels really empowering for our students and early career nurses, because they can get a sense that they are part of the change that they want to see. But also that they aren't needing to be frustrated in their own areas, that they don't need to feel isolated with this motivation to want to influence, that there are others that share that same ambition. And as Shazia says, that being part of that community just really creates energy and inspiration constantly. I'm completely blown away many, many times. I'll just pause for a moment before we tell you what we have on the programme coming up, and just check if there are any questions that anybody would like to ask. Either pop them in the chat, or please do feel free to pop your camera on and ask a question.
Hi, yes, I have a question.
Go ahead. Thanks, Vivian.
Hi, my name is Vivian Wogo. I'm a registered nurse in United Kingdom here, but I trained in Nigeria. So my question has to do with the publicity is strong, but people really understanding what it was like. Because in 2007, I graduated 2016, and 2017, I didn't like the state of nursing in Nigeria, and I really wanted to do something about it. So I came up with an idea to have an organization called Nurse Hub Africa, through which we helped retrain some nurses that we felt like didn't have the right training they needed, and also got them involved in community engagement. But my main reason for setting it up was to make it easy for exchange of knowledge between nurses in Africa and nurses in the diaspora at that time, because I felt like we were way behind. And then in 2020, when this campaign launched, I saw it online. I was very excited about it. And I was like, okay, this is a very good opportunity to kind of become a part of the global community. So I'm going to show you something. We went as far as launching as a local group, had a whole event, and even an award to support it. Let me show you. This is just one of the pictures that we had. We recognized a lot of nurses from different countries, and they were really excited. So we tried to connect with the Nursing Now to kind of let them know, because at that time I was still a very early career nurse, because I had graduated 2016 and this was happening 2020. But there was no headway. So we tried to register as a Nursing Now local group. There was no yes, we were able to register on the website, but there was no feedback on if we were members or not. We had a whole huge network of nurses. There was no significant progress. We were just campaigning for the challenge because it was something that I was passionate about. The whole team were passionate about nursing itself. So I'm just asking, like, the people that are part of the community, was there a different way they were able to get in and get engaged? Because this would have really, really helped at that time. And
Thanks, Vivian. That's really helpful. So I think what you've described for us, Vivian, is how the Nursing Now Challenge has developed over the years. So what you described previously, Nursing Now, was an initiative to support organisations to put their own leadership development programmes together for students and early career nurses. And Nursing Now at that time was really about just encouraging organisations to do that. And I'm disappointed to hear that you didn't feel that there was much support from the campaign at that time to link in with others and learn together. I think other organisations did benefit from that. But we're a progression of that now, Vivian, where absolutely those in-country and in-organisation leadership programmes we want to support and encourage. But what we're offering now is a programme in its own right. So this is the Nursing Now Challenge. This is the next iteration of Nursing Now. And this is about bringing together those students and early career nurses as a global community, and then to think about how they want to organise to take action forward within their own context. So we hope what we've done is to address some of the challenges you experienced by having a more coordinated and structured programme that anybody can engage in, whether you're an organisation or an individual.
Thank you very much. I mean, I'm really glad to be able to kind of come here and really understand the perspective. So another question that I have, sorry, is it, so I'm now more than 5 years in the nursing career. I currently work in the NHS now in United Kingdom, and Nurse Hub Africa is also in UK registered now. Is this something that we should continue, or have I passed the early career nursing?
Well, we definitely would want to connect with you because it sounds like you have a lot of shared values with what we're looking to achieve in the programme. So let's have another conversation following this webinar, Vivian, and see how we might be able to do that.
Okay, all right. Thank you.
Thanks for your question.
All right.
Any other questions there? We've got some nice examples of organisations that have taken forward their own leadership programmes, and we're actually sent out a survey recently to find out how many organisations do have these programmes still sustained, and how best we can support you to take those forwards and learn from them. Sala.
Thank you, Gemma. This question is for Shazia. I think it's to help encourage other people to engage with Nursing Now. What was your pivotal moment? What was your aha moment that said, oh, this is going to be useful for me in my career? Reason I'm asking that question is that a lot of students, especially culturally where we come from, we were told, just go to school, do your school, everything else is a distraction, that's not useful. what would you say to that student that's just focusing on the academic pathway to get through their course, to help them, encourage them to say this is helpful? So what was your aha moment?
Thank you, Sarah, for this wonderful question. Okay, so this question actually made me retrospect on my student experience when I was a nurse and studying at the school. So I was always, the one who just is not satisfied within the classroom. I always loved to interact with nurse leaders, and through conferences, through webinars, and these experiences. And the university was one of the base that provided me the confidence to just get out of my comfort zone and just learn and keep learning. But sometimes the pivotal point was actually some of the nursing, leaders, and I would say ideals who I looked up to when I was in nursing school. And Sana Gulbalot, I don't know if she's here or not. She was one of the great inspiration for me. So she was literally participating in, leadership roles and impacting students and coming to the wonderful platforms, represented nurses and doing the advocacy. So it's always, a passion that is coming, from depth of your heart, and, surrounding yourself in an environment that actually influences you. And I think being part of, gatherings, for example, a webinar like this, where you get to, see nurse leaders and interact with them, is a great chance where we can, start the learning journey. And, involving the students in opportunities like these, it can be really helpful. And so it's like two-step process. That is a personal search. It comes from the depth of your heart, and then surrounding yourself with people who actually really makes impact. Yeah, I hope that answers your question, Sarah. But we can talk more about it during the training course anytime.
Thanks, Shazia.
Thank you, Sala and Shazia. And I think that again resonates with what I've heard from the community around nursing often being such a hierarchical profession, and the lack of opportunity to be able to have conversations with those in position of power and influence. And what Nursing Now Challenge often does is enables that hierarchy to be dissolved for a period of time, to have those open dialogues. And what we find is those people in those decision-making roles really value and need those insights to inform their decision-making and their ways forward. And it can completely change their position and views when they hear from our community. So yeah, brilliant example. Thank you, Shazia. Now I'm conscious of time. I'm going to ask Hannah just to share those last slides so we can tell you a bit more about what's on the horizon for Nursing Now Challenges over the next few months. So I guess what's really important to say is what Shazia has described in terms of her experience has been largely down to her individual motivation to want to engage and take advantage of the opportunities that are there. And that's what we would really encourage you to do. So there's a range of different opportunities, some of which are directed at in-country. So for example, our Africa Hub are providing 2 webinars throughout May, one focused on the International Day of the Midwife and one on the International Day of the Nurse. And that's about bringing together key speakers relevant to their country, their region and their context to create debate and conversation. Everybody's welcome to those, but it's the Africa Hub that have defined what they are and who the speakers will be. For the broader Nursing Now Challenge community, we, as I mentioned before, have a live global solutions initiative running at the moment around research. And our 3rd workshop within that programme is scheduled for the 8th of May. And we would really encourage you to join that. Even if you've not heard the first 2 sessions, you can always watch them back. All of our webinars are recorded and available on our YouTube page. And then really importantly, and I'll move us on to the next slide to tell you a bit more about this, we have a great event planned for International Nurses Day on the 12th of May. So we're holding an online conference. We've called it The Future Is Now. And so we're really wanting to emphasise that our community, our leaders right now, they have opportunity to influence, and our role is to bring them together to consider what collective action is most relevant and meaningful for them. So we'll have presentations from the WHO, the World Health Organization, around State of the World's Nursing report and how the recommendations are progressing, and opportunities for our community to be involved in that in country. We've also got presentations from the International Council of Nurses, and we're learning about their latest campaign around empowered nurses and what that framework means in terms of how we can take forward some of the recommendations from there as well. So real opportunity to be in dialogue with these global leaders and institutions. And then the afternoon will give us opportunity to debate and discuss. So there'll be lots of interaction throughout the day, and we'll be asking some really critical questions of our community, and together developing a position paper which we'll publish in the Journal of Advanced Nursing around our thoughts for the educational preparation and professional development of the nursing workforce, to enable us to respond to what is a very uncertain and unpredictable future. We've got loads of partners joining us on the day, and through this virtual platform you'll have opportunity to interact with those partners and learn more about their organisations and how you might want to get involved, as well as interacting with each other. So it's a very clever bit of software that's going to enable us to have a very interactive day. So hopefully you can join us, if not for all of the day, but some of the day, and similarly, all the sessions will be recorded. And then in June, we are launching our Planetary Health webinar series, as I mentioned before, and this is in collaboration with the Centre for Sustainable Health. We have our 4th Leadership Insights programme session, which is all about how we make change happen. And again, as I mentioned before, our Global Book Club, which is going to be with the authors of a book that will be published very soon around flourishing in nursing. And the authors Claire Cable and Kate Green's book will be available to our community for a question and answer. So really, the message is to stay connected, get engaged in whatever way you think is most valuable for you in the stage that you're at in your career. How can you share this message more broadly, more widely in the communities that you are connected with? So here are our social media handles, but if you are registered, we'll automatically be receiving a welcome pack and be added to our mailing list. Thank you again so much for joining us. It's been a real pleasure to spend this time with you. Thank you to Shazia for giving us your lived experience and insights of being part of the community, to Vivian and to Sala for your questions, and really just an invitation to every one of you that have joined today to be part of the conversation that we're starting, to be part of a community that brings together like-minded, passionate, motivated students and early career nurses, either as yourselves to take advantage or thinking about how you can really foster that within the organisations that you're here representing. Thank you again, and have a great day, everyone.
Thank you.
Thank you. Can I get your email?
We shall pop it in the chat.
Okay, thank you.